Member for Richmond-Steveston.
Thank you, Speaker. It's well known that some of the earliest settlers in Steveston arrived from Japan in the late 1800s and were valued as skilled fishermen and boat builders. They also faced discrimination from some of the white community, with cannery bosses paying them less for their catch than white fishermen. Discrimination also prevented them from accessing health care. Tomokichi Homa, who immigrated to Steveston aged 18 in 1883, worked tirelessly for fair treatment of Japanese Canadians in their home of British Columbia. Tomokichi Homa was a labor organizer and founded the Japanese Fishermen's Benevolent Society in 1897. The society did important work to mitigate the disadvantages inflicted on their community by building a school so children could learn and a hospital that provided good care to anyone seeking it, regardless of ethnicity. Most famously, Homa-san sued for the right of Asian Canadian suffrage and won his case at the local court and the Supreme Court. The provincial government of the day then took the case to the British Privy Court, which ruled against him. We know that story, but in minority communities in British Columbia live stories of inspiration and resilience that are unpublished. The hospital founded in Steveston had an annual membership of $8, and it included all medical services except for surgery. Many children of all ethnicities were born at this hospital, since it was far closer than the hospital in either Vancouver or New Westminster and welcomed everyone. The resounding success of the hospital quickly gained the attention of Kunito Tomi Shoyama, a Japanese-Canadian journalist in Vancouver. He spent time with Tomokichi Homa and learned all he could of this novel way to provide health care with easy access to all in the community. He was inspired by the vision of good, accessible healthcare and went on to work with Premier Tommy Douglas on the implementation of provincial healthcare and later went to Ottawa to work on national universal healthcare. I'm grateful to the Japanese Canadian community in Steveston for sowing the seeds of public healthcare in Canada. And I also want to thank Jim Kojima for generously sharing his time with me. Thank you, Speaker.